Welcome back. In this session, we are going to discuss about another homeopathic remedy called Stannum Metallicum. Common name of Stannum met is tin. You can see the picture here. It is nothing but tin, commonly known as tin. It was proved by Dr. Hahnemann and it belongs to the mineral kingdom. So let us understand about this Stannum, how it was introduced into homeopathy. Initially, in the ancient times, they were used for the various ailments till the homeopathy came into the field. The allopats used to use this remedy as a vermifuge. So, allopats use Stannum as a vermifuge. Vermifuge is nothing but the worm expeller, used to expel the worms in the kids and also in the adolescents. It is used as a worm expeller. Because of the keen intellect of Hahnemann, this keen personality of Hahnemann made him to understand and unfold the properties of this neglected mineral tin. And he took up the task of proving this remedy and introduced into the field of homeopathy. Tin is also a component of bronze. In homeopathy, the screwed material was well pulverized, so it was brought down into fine particles. He pulverized it and then he used it as a remedy after potentization. So it was this Stannum was subjected to potentization and later introduced into homeopathy. Moving further to the sphere of action of Stannum. The chief action of Stannum is centered upon the nervous system, respiratory organs, and female genital organs. What is the pathogenesis? Acting on the respiratory system, it will produce the catarrhal inflammation of mucous membrane. We see acting on the respiratory system, Stannum will cause the profuse catarrhal inflammation of the mucous membrane, producing a large quantity of mucopurulent expectoration. How is the expectoration in Stannum? It is profuse and mucopurulent. It induces cough and bronchitis. Acting on the central nervous system, when it acts on the cerebrospinal system, it leads to prostration, profound prostration. There is prostration, exhaustion, paralysis, convulsions, and neuralgic pains. So we see central nervous system, so all the paralysis, convulsions, we have paralysis, convulsions, neuralgic pains, prostration. So we have prostration, paralysis, pain, neuralgic pain, and convulsions. Moving further to the constitution. The Stannum is suited to the people who have long been growing feeble. For a long period, they have started to grow feeble. They have started to become weak. There is increasing weakness in the people. Cachexia with a sallow, waxy countenance. So they have this yellowish discoloration all over their body and the face. Sallow is yellow, sallowish, yellowish. Waxy countenance and dark rings under the eyes. They are cachexic. We see the muscle wasting in them. There is muscle wasting, yellowish coloration of the face, the blue rings around the eyes. In the picture you can see they have blue rings around the eyes. They have blue rings. Stannum have blue rings around the eyes. They are cachexic. They have muscle wasting, weakness, and they have increased weakness, yellowish, sallow, waxy countenance. Okay. The relation with the heat and cold. So thermally, there is no clear-cut indication about the fact whether the patient is chilly or it is hot. We don't have a clear-cut indication. Yes, the patient is hot. No, we don't know. It could be ambithermal. It could be fluctuating between heat and cold. The miasm sora in the background. We saw it is more of inflammation. We saw the bronchitis producing mucopurulent discharges. Inflammation is probably observed here. So we see the miasm sora is in the background. Diathesis, tubercular diathesis. The diathesis is tubercular. So, what do you understand by the term tubercular diathesis? Tubercular diathesis, the parents would have a history of TB. The parents of the patient could have a history of TB. The patient is very weak, prostrated, there is muscle wasting, and he has a history of, there could be history of asthma, there could be a history of whooping cough in the patient. Okay, tubercular diathesis. Guiding symptoms. The guiding symptoms of Stannum met is very important. It requires your attention because the same guiding symptoms and the modalities will be applied to every particular. Once you're thorough with the guiding symptoms, the particulars becomes very easy. The pain begins slightly and increases gradually to a highest point. That's the reason I've given you a graph so that you can understand and remember this point very clearly in your minds. We see that the pain is beginning slightly and gradually. You can see the pain beginning gradually, going on gradually increasing, and it reaches to a highest point. We saw that it is reaching here to a highest point. Once it hits the highest point, and then it starts to decline gradually in the same manner as it appeared. The similar symptoms is found in syphilinum and platinum. The characteristic of pain is similar in platina and syphilina, where the pain starts slightly, keeps on increasing gradually, hits a highest point, then again descends in the same way. It declines in the same manner as it ascended. The same way it is going to decline. Ascend, hit a point, decline. Okay, you need to remember this point. There is a great debility and profound weakness. We saw the constitution, so relate here. The patient is debilitated. He has profound weakness, which is a keynote of Stannum. What is the keynote of Stannum Metallicum? Weakness, debility, profound weakness, great debility and profound weakness. Immensely exhausted patient. He is weakened, debilitated person. This is the keynote of Stannum. It has marked debility both mentally and bodily. The weakness is seen, bodily weakness as well as mentally. You can see the picture here. Mentally as well as bodily, the patient is profoundly weak and greatly debilitated. The chest is so weak so as to make the talking difficult. It sometimes becomes impossible for the patient to speak. The chest goes so weak that he is unable to communicate. So guys, what did we understand in this slide? The patient is extremely debilitated and there is profound weakness, so weak that he is unable to speak. The patient is so weak that she drops into a chair. She or he drops into the chair instead of sitting down. So we see the patient has just dropped himself into the chair instead of just relaxing. How do normally people sit? They are relaxed. Okay, they relax and sit. Whereas this person is completely dropping himself into the chair instead of sitting down. So exhausted, so weak is the patient. The patient is so weak that they can barely speak up, or they just drop themselves into the chair instead of sitting down. Feels weak and faints, especially when going downstairs. We see the patient is so weak that he is falling down the downstairs. When he's coming down, you can see the picture here. Usually what happens, the climbing will be difficult. Stannum can go up well. He can go up easily, well, good enough. He can climb the stairs. But when he's coming down, when he's descending, coming down the stairs, he feels weak and he faints. Other remedies which have this indication is borax and chamomilla, where the patient faints when he's coming downstairs. Borax and chamomilla. Can go up well enough. We have the reverse. The patient has difficulty in going upstairs in cases of calcarea carbon iodum. Calcarea carbon iodum, the patient has a difficulty to go upstairs. So guys, what are the weakness points we saw? There is profound. So we saw that there is profound weakness, and great debility and profound weakness. The weakness is so marked mentally as well as bodily. First thing about the weakness. And second thing, the chest has a weakness. So weak is the chest that the patient is unable to speak, he has a difficulty to talk. Third, because of the weakness, the patient just drops himself into the chair. And the last fourth point, he has a difficulty going downstairs, he faints. Okay, these are the 4 points we saw so far for the weakness. Empty sinking all gone sensation in the chest and stomach. He has this empty all gone sensation in the chest. As well as in the stomach, he has this all gone sensation. Yet is another grand feature of Stannum. So we see empty sinking all gone sensation. All gone sensation, empty, everything is gone away, empty feeling, especially in the chest and in the stomach. It is a grand symptom of Stannum met. Okay, what are the grand symptoms we saw? The great debility and profound weakness, and empty sinking all gone sensation in the chest and the stomach. These are the two grand symptoms. Moving further, there is sweetish and salty expectoration and taste in the mouth. What is the taste? What sort of a taste do they have? They have a sweetish and salty expectorations, and the taste in the mouth is also sweetish and salty. Sweetish and salty. The patient experiences very debilitating sweat. Okay, how is the sweat? The sweat is so profound that the patient becomes debilitated. Especially after 4 a.m. there is sweat. Okay, the patient experience very debilitating sweat after 4 a.m. Clear, guys? Yellowishness of Stannum secretions is worth nothing. So our master Hahnemann says that the yellowishness of the Stannum, so important are the discoloration in the Stannum which is yellowish, all the discharges are yellowish, that the yellowishness is worth nothing, especially in the leukorrhea, the expectoration, the sputa we see, it is very yellowish in character. Before moving further to the mental symptoms, let us have a quick revision we saw. So we see how does the complaints begin. The complaints will begin lightly, increase gradually, hit a point and then descend downwards. Gradually they will descend. Weakness, we saw there is debility, profound weakness. The patient is weakened both mentally, bodily. He drops himself into the chair and he faints when he's going downstairs. And there is empty, all gone feeling in the stomach. There is sweetish, salty expectoration, and the taste in the mouth is sweetish, salty, and debilitating sweat at 4 a.m. Yellowishness of the Stannum is worth nothing. Moving further to the mental symptoms. Mentally, the patient is very much sad and despondent. She manifests a great sadness. You can see the picture here, the patient being very sad. She's despondent. She is manifesting a great sadness and a disinclination to talk. She doesn't like to talk. She is disinclined to talk to people, avoids conversation, and a pronounced aversion to the company of men. Okay, Stannum met has aversion to the company of men. Stannum met is the remedy which has aversion to the company of men. She does not like to communicate, has aversion to the company of men. Okay, she is anxious, weak, and irritable. We see she is weak, she is irritable, anxious. Disposition to weep. She feels like crying all the time. Stannum met patient feels like crying all the time. She cry at any time, but crying will make the complaints more worst. There is continued restlessness with anxiety. So we see that the patient has restlessness, there is anxiety, weeping tendency. She feels like crying all the time, yet the crying gives no relief to her. Okay, crying gives no relief to her. Aversion to the company of men, disinclination to talk to others, and then very much sad, despondent. Okay, her distress of mind ceases as soon as the menses begin to flow. So we see as soon as it is a sora in the background, so the natural discharges are going to ameliorate. As soon as the menses are beginning to flow, the complaints will come down. These mental symptoms are caused by emotion and fright. What is the causation? for all these mental symptoms? When does she become sad and she feels like crying all the time, weeping, despondent, and aversion to talk to people, likes to isolate herself? So all of these complaints, what are the cause for it? The emotional disturbances, when she is emotionally disturbed, or any fright. Okay, the fright and emotional changes, emotional disturbances will cause the complaints. Moving further to the ailments from, we saw emotions and fright. Along with, we have masturbation, dentition, worm, and overuse of the voice. So when we study the respiratory symptoms about the hoarseness, that the patient loses his voice. The hoarseness is such marked that the vocal cords will stop responding and the patient cannot use his voice any longer. So the overuse of the voice is one of the ailments from. And the worms, dentition, masturbation, and frightened emotions we have already seen. Moving further to the particulars of Stannum, headache. How is the headache? Headache is caused, again, the ailments from are the fright and emotions. We also have headache due to sexual excess. When there is sexual excess, there is headache. The location of the headache is over one or the other eye. We see over one or the other eye there is sexual excess, and because of the sexual excess there is headache which is locating on one or the other eye. Especially on the left side the headache is located. She feels as if the head would burst from inward blows. She feels the head is going to burst because of the inward blow. You can see the patient feels the head is just going to blow away. The head is going to blow because of an inward. The head is going to burst open because of the inward blows which are given. If it is constricted by a hand, and if they feel as if the head is being constricted by a hand. Character of the pain. Aching pain is felt in the temples and in the forehead. There is violent blowing, beating pain, beginning lightly, increasing gradually to a highest points, and then gradually declines. So we know the character of the pain. We just have to remember how it ascends and hits the highest point. Gradually it increases, hits the highest points, and gradually declines. What is the character? Character, it is blowing, beating pain. Okay, blowing and beating pain. Aching pain, it is felt in the temples and the forehead. Clear, guys? You see it is on the temples, near the temples and the forehead. You can see in the picture clearly headache in the temples and the forehead, settling above the eyes, especially the left sided headache. Okay, clear, guys? Moving further to the modalities of headache, it is aggravated from motion from 10 a.m. to 3 or 5 p.m. It is beginning at 10 a.m. in the morning, continuing till 3 to 5 p.m. in the evening. It is ameliorated by hard pressure. Okay, the headache is ameliorated by hard pressure. Moving further to the abdominal complaints, there is colic in the abdomen. So we see the patient has colic in the abdomen, especially around the navel. The colic, you can see the colic. You can see the colic around the abdomen. The colic is present around the navel of the abdomen. The colic is around the navel. There is a sensation. What is the sensation, guys? We studied in the guiding symptoms. There is empty organ feeling in the abdomen as well as the chest. What is the character of pain? The colicky pain, which is cramp like pain. How does it increase? Lightly, and it keeps on increasing gradually, hits the highest points, and then gradually it declines down. Along with this, there is nausea and vomiting from the odor of the cooking food. We see there is nausea and vomiting. There is colic in the abdomen, around the navel, empty feeling in the abdomen and chest, cramp like pain. How does it begin? Lightly, gradually ascending, and descends gradually. And then we see that there is nausea and vomiting associated, especially when there is an odor of the cooking food. Just from the odor, just from the smell or the odor which is coming out of the cooking food. Okay, let's consider this is a cooker, this is the vessel. So because of the odor which is coming from the cooking food, the patient has nausea and vomiting. The complaints are aggravated from drinking anything warm, and it is ameliorated by heart pressure. You can see the patient here. The heart pressure gives amelioration, and also by lying on the abdomen across the knees. When you lie on the abdomen across the knees, again we have the pressure here, heart pressure on the abdomen, which is ameliorating the complaint. Clear? Let's move further to the respiratory symptoms. Respiratory symptoms of Stannum mat is very important from the exam point of view. Very important are the respiratory symptoms. We need to focus on the respiratory symptoms. Respiratory symptoms beginning with cough. So let us start with cough. How is the cough? The location, the left sided chest. You can see the left side of the chest is predominantly affected. You can see the left chest is predominantly affected. Empty organ sensation in the chest, weakness in the chest accompanied by soreness in the chest. Because of the guiding symptoms, we know half of the points. We are very clear how is the character of the pain, what is the sensation. So again, in the chest there is empty organ sensation in the chest. There is weakness accompanied by soreness in the chest. What is the character of pain? Stitching pain is felt in the left side with oppressive and short respiration. So we see the left side of the lung has a stitching pain, and on the left side of the chest the patient experiences the stitching pain with oppressive and short respiration. Moving further to the larynx, there is rawness and soreness in the larynx and trachea. Okay, you can see the larynx, trachea, everything is going to be swollen. There is soreness. The soreness is going to be present in the larynx. It is going to be present in the trachea. There is smarting sensation. The smarting sensation is carrying away down when the patient is coughing. The pain, how does it begin? Lightly increases gradually to a highest point, and then gradually it disappears. In the same manner as how it appeared, it will disappear. What is the character of the cough? Cough is deep. It is hollow, shattering, strangling. Concussive cough in paroxysms of 3. How does the cough come? It is a deep cough. It's not a superficial cough. It is a deep cough producing expectoration, and it is shattering, strangling. The patient feels as if somebody is trying to strangle him. That severe is the cough. They have a strangling cough, strangling, shattering, hollow cough. In paroxysms of 3, which is the other remedy which has paroxysms of 3? We have cuprum met, where we have cough in 3 paroxysms. There is fatiguing paroxysms with a hoarse, weak sound. Okay, so we see the paroxysms are associated with a weak, hoarse sound. Moving further to the character of the sputa. The sputa, there is large accumulation of the mucus in the trachea. It is easily thrown off by coughing. Expectoration, it is very productive cough. The expectoration is easily thrown off by coughing. Expectoration is profuse in quantity. White mucus like a white of an egg. How is the expectoration? Like the white mucus, like the white of an egg, the expectoration is observed. Yellow-green pus with a sweetish, salty taste in the mouth during the day. So we know the expectoration is yellowish, the taste is sweetish and salty taste. There is inexpressible weakness in the chest. We see the weakness is also there. She is unable to talk. So weak is that the weakness is so pronounced that the patient is unable to talk. Moving further to the modalities of cough, it is aggravated from talking, singing, laughing, lying on the right side, and drinking anything warm will cause the cough. So we see in cases of cough, when the patient is lying on the right side, they have pain. Amelioration is from expectoration and hard pressure. Amelioration is hard pressure. Moving further to the hoarseness. Hoarseness, why is the hoarseness seen in the patients? It is because of the paralytic weakness. Because of the paralytic weakness, they have the hoarseness. And what is the sensation? Again, weakness is manifested in the voice. When we studied the cough, we saw that the patient produces a hoarse, weak sound. So the weakness is also manifested in the voice. Everywhere, even in the cough, the paroxysms are weak, the hoarse weak sound is produced. In the hoarseness of the voice, there is again weakness which is manifested in the voice. The hoarseness is associated with a loss of voice. Vocal cords will stop responding. Talking makes him feel weak. There is deep, hollow, husky voice. Okay, there is a deep voice, hollow, and husky voice. What is the modality? It is worse from using the voice. We saw the ailments from the overuse of the voice, and the patient feels better by coughing. So we know from just talking, singing, laughing, all of these will aggravate the complaints. And the patient feels better by producing the expectoration. So even in the cough, we saw that from the expectoration, the patient feels better. There is yellowish greenish pus like expectoration, right? And it is which is easily thrown off by coughing, and that coughing will ameliorate the complaints. The coughing producing expectoration, the expectoration when it is thrown off will give relief to the patient. Moving further to the pulmonary tuberculosis, which is nothing but the thesis is the old term, now we refer it as pulmonary TB. So the Stannum met is useful in warding off the cases of thesis or TB. It is used as a wonderful palliative in the disease. It immediately relieves the complaints. It is used as a palliative in cases of pulmonary TB. There is history of weakness, cachexia, catarrhal condition with a debilitating sweat and hectic fever. We see a debilitating sweat. We saw the profuse in the guiding symptoms. We saw that the sweat is so profuse that it is causing weakness in the patient. Okay. They have hectic fever, the body is weak, sallow countenance, pale face, blue rings around the eyes, all of this you can mention. Moving further to the sensation, there is empty, all gone feeling in the chest, so weak that the patient is unable to talk. How will the character of cough be? There is dyspnea, there is shortness of the breath, the patient gasps for air. There is oppression of the breathing, violent rocking cough, gagging, retching is of the most intense suffering. So you see the character of cough varies. Generally, if you have to indicate the cough, general cough, if you have to indicate this remedy, the cough is going to be shattering, strangling, as if somebody is strangling the throat. They have the deep, hollow, shattering, strangling, concussive cough in paroxysms of 3. In cases of pulmonary TB, how is the cough? The cough is rocking cough, violent cough with gagging. Retching is the most intense suffering of the patient is the retching. What is the character of sputa? Sputa is copious, thick, yellow, bloody sputa. Copious, thick and yellow bloody sputa. Expectoration will taste sweetish and the chest is filled with mucus. He coughs and expectorate, and yet some still remains. The patient keeps coughing. He throws out the expectoration. Yeah, it does produce some relief to the patient, but he has that sputum still accumulated in the chest. He coughs and expectorate, yet some like sputum is still there in the chest. How is the perspiration, guys? It is exhausting perspiration. We saw the profuse debilitating sweat with a hectic temperature, and also in the fevers they have this debilitating sweat, and especially the sweat is observed on the forehead and the nape of the neck. They have a debilitating sweat which is smelling offensive, musty every day morning 4 a.m. at night, right? So every day morning 4 a.m. they have this debilitating sweat which is smelling musty and offensive. Okay. How is the leukorrhea? Now we are moving further to the female genital organs. Also, we need to mention about the menses here. I'll just brief you through the menses. In Stannum met, it is also indicated in menses. Stannum met. Okay, we will first study about the menses. Following, we will deal about the leukorrhea. And now we studied, what were the sphere of action, guys? We studied the respiratory complaints, the main important respiratory complaints. Now we are going to study about the female genital organs. In the CNS, we saw it causes paralysis, profound weakness, prostration, and all that. Convulsions. Now we are going to study about the female reproductive organs of the Stannum, wherein we are going to discuss about the menses. How is the menses in Stannum? The menses comes too early. Too early the menses appear. The quantity is going to be profuse. The quantity is profuse. Before menses, the sadness will prevail. We saw during the mental symptoms, while dealing with the mental symptoms, we saw that the patient will be sad. The patient will be sad, despondent, aversion to talk to anybody. She has aversion to the company of men. She feels like crying all the time. So all of these complaints are seen. She is very sad before menses. Other remedies which have an indication where there is sadness prevailing before menses is nitric acid and ammonium carb. We observe the sadness before menses in nitric acid and ammonium carb. Let me just write it down for you. Nitric acid and ammonium carb. Ammonium carb have sadness before the menses. And we see that during menses, there is pain in the malar bones and also bearing down sensation. When we study the prolapse of the uterus, we'll see the patient has a bearing down sensation. The patient has bearing down sensation during menses and pain in malar bones. What is the character of pain? During menses, there is pain in the vagina, which is shooting upwards with a great weakness. The pain from the vagina will start shooting upwards. We see from the vagina it will start shooting upwards. From the vagina it starts shooting upwards. And while dressing in the morning, the patient has to sit down several times to rest. She is becoming so weak during menses that just to change the clothes, she is unable to perform the daily routine. She just sits down multiple times, several times while changing her clothes in the morning. Now let us discuss about the leukorrhea. You see the patient is again exhausted, weak and greatly debilitated. The weakness is seen in the chest. There is prostration of strength. How is the character of leukorrhea? Leukorrhea is transparent yellowish mucus. The leukorrhea has transparent and yellowish mucus character. There is prostration of strength, debility, weakness, which is starting from the chest. Moving further to the prolapse of the uterus, there is bearing down sensation in the uterine region. So this bearing down sensation is seen in cases of prolapse of the uterus and the prolapse of the vagina. The patient is so weak that she drops herself into a chair instead of sitting down. There is a sensation of prolapse which is aggravated during stool. So we see the rectum is just located behind the uterus. So whenever she is passing the stools, there is pressure and it also causes the prolapse of the rectum to increase, prolapse of the uterus when there is pressure which is exerted in passing the stools. Moving further to the general modalities, it is aggravated by laughing, singing, talking, using the voice, or lying down on the right side, or drinking anything. When the patient is lying on the right side or drinking anything warm will aggravate the complaints. The patient feels better by coughing and expectoration. The expectoration will relieve the hoarseness, and generally the complaints are better by heart pressure. So this is all about our long, big, deep acting, long acting remedy, polycrest remedy called Stannum Metallicum. I hope everything is clear. Feel free to ask any doubts in the comment section, and if you like the video, hit the like button and please subscribe.